Hello, everyone. Okay, let's get straight into it. So, you guys have voted for the live topic today to be on dental health care for dogs. And I'm so glad that you did actually, because this is really important stuff. And that's mainly because if we don't look after our dog's teeth, then it can shorten their lifespan. And dental disease, or periodontal disease as we call it, is really common in dogs. We see it in about up to 80% of them. So it's something that every vet will see every day in practice. So the more that we're educated and aware about reducing dental disease and preventing it from developing, the better and the more healthy our pets will be. Now, the first thing I want you to know about gum disease or dental disease in dogs is that it's silent. And what I mean by that is there's in the early stages, or even in the more progressed stages, there's often no outward signs or symptoms of the condition at all. It's only when it advances to the really serious condition, where there's chronic pain and eroding gums and damaged teeth and bone loss, that dog owners actually start to notice the symptoms. And so that's where I see myself and other vets come in, because we have an opportunity to talk to you about it, diagnose it early on, and do what we can to slow the dental disease process. So why do dogs get dental disease in the first place? Well, it's a combination of things: the bacteria in your dog's mouth, the food particles that get stuck on their teeth, after they eat, as well as the dog's inflammatory response, so the dog's immune system. So imagine after a dog eats, just like us, the food particles get stuck on the teeth and there's bacteria there, and together that forms plaque, that furry feeling that you know well on your teeth. This sticky film is where it all starts. Now, the dog's immune system, rightly so, identifies this bacteria and this foreign food matter in the mouth as a foreign invader. And then it sends its marshals out, which you can imagine I'm calling them marshals, but they're white blood cells. So they kind of get recruited and they all go to the gums. And then the white blood cells in the gums are then releasing enzymes, to kill the invader. But in doing so, they actually break down the gum tissue. So then we get inflammation, we get destroyed gum tissue and loss of bones and of bone, in the mandible and the maxilla. So then the outcome is tooth loss. So this gum disease, or your vet will call it periodontal disease, happens 5 times more in dogs than it does in humans. And that's because of 2 things. One is because dogs have a more alkaline mouth than humans. And when you have an alkaline mouth, it promotes more plaque formation. The other is most pets don't have their teeth brushed twice a day, and we'll talk more about that soon. And of course, when we're not brushing our teeth, this gives the plaque and the plaque-forming bacteria a really great opportunity to multiply and thrive. And so that's why we see much more dental problems in dogs. So what are the symptoms then? Well, as I mentioned, there are no symptoms at first, and that can mean it's quite a shock to the owner, when they say come in for something entirely different, or maybe they're just in for their annual health check or vaccination. And then the vet says, whoa, did you know your dog has really serious periodontal disease? And it can be quite a shock to people. And I always try and tread lightly, knowing that there's a very good chance that these owners have no idea that this is even happening. Later on, though, when the disease is much more advanced, then we start to see symptoms popping up, but not always. Those symptoms might be that you notice your dog kind of hesitating at their food bowl. They might have problem picking up dog food, or they might be dropping it out of their mouth. You might notice when you lick up the lips, like in this photo here, that The gums are quite red, particularly at the junction between the tooth and the gum. It's kind of inflamed and red. It might even be bleeding. You might notice loose teeth or teeth falling out, or blood in their water bowl or on their chews. These are all quite rare, though, I must say. Not many people notice these things. I would say the most common symptom of dental disease that owners report to me is they come in and they say, my dog has really stinky breath. And that's what vets call halitosis. And it's often the first sign that prompts us to bring those lips up and have a look at what's going on. The serious, I mean, if that wasn't serious enough, the more serious side of periodontal disease is that it can have complications, which are much more severe than tooth pain and tooth loss. And that's where the bacteria that is accumulating in the mouth spreads to other parts of the body. So if you think of an example of a dog with severe gum inflammation, then your vet will be thinking this dog is at higher risk of heart disease, kidney disease, and liver disease, because that's a constant source of bacteria. Okay, so I'm guessing if you didn't know all of that already, I'm guessing you did have some idea of the problems with, canine dental disease, how prevalent it is. And that's why you voted for this topic, because you wanted to learn ways to prevent it. So I put together 4 key things. There's lots of blogs, lots of ideas, but I think there's 4 main things that you guys can do to prevent or at least slow dental disease in dogs. Okay, so number 1, just like you go to the dentist regularly, your dog has to too. So you're going to have to take your dog into the vet for regular oral exams and cleanings at your vet clinic. Unfortunately, dogs don't sit still for injections into the gum, for procedures, like scale and polishes like we do, laid back, reclined in a chair. It's just not going to happen with dogs. So for vets, we have to do a general anesthetic in order to do an oral exam, in order to do dental x-rays and scale and polishes and extractions. So it is a bigger procedure, and your pet will have to stay in the hospital for the day, because what would be much easier if they held still and let us do things, it ends up having to be a full day in theatre or a full day in the hospital and going to theatre. So really that is necessary for vets and vet nurses to get a good picture of what's happening in a dog's mouth. So that's number 1. Your dog has to go to the dentist or the vet. Number 2 is brushing your dog's teeth every day. And I know this is so daunting, but it is really the best way to maintain good oral health, just like for us. And I know it's difficult, and it can be a struggle at first, but with patience, the right tools and the right process, it's really not that bad. If you've got my book on page 142, there is the steps and the details on how to brush your dog's teeth. It requires training, it requires starting slowly, and it requires using a bit of beef stock or something tasty, using your finger to start with, and step by step getting them used to the brushing teeth process. But once you do, it will be easy, and then you can ensure that your dog's teeth are brushed daily, or at least as much as you can. Number 3 is to feed your dog a high quality food. Now, there are dental diets which usually have a bigger kibble, and they work in that they kind of scrub the dog's teeth as they chew. Some dental diets also have an additive to prevent plaque from hardening and forming. You can talk to your vet, about what the right diet is for your dog. There's a lot to consider, other factors as well as dental health. I've seen dogs with beautiful teeth that are fed raw food. I've seen dogs with beautiful teeth that are fed dental diets and high quality kibble. So there's no right or wrong. There's different things to consider if your dog has other conditions or your lifestyle, what you can and can't do. But whatever you do, make sure it's premium and very high quality dog food, because the rubbish food, the cheap stuff that you'll get on sale at the supermarket, is got fillers in it and it's poor quality. And so that sticks to your dog's teeth and it promotes poor dental health. Wet food as well is thought to stick to the teeth and promote the plaque developing. So the more chewing, the better, and that tends to be in dry food or raw kind of food with bones. Number 4 is encourage your dog to chew. Now, this is where the debates begin. I can only safely advise you to make sure that you're using safe toys and safe chews for daily chewing. Dogs should chew every day. That's what they're designed to do. And chewing makes for healthy teeth. But you've got to, it's tricky because you've got to look for chews that are not too hard, that are not too soft, that they can't swallow. Raw hides were meant to be great, but dogs have swallowed that and had to have, emergency surgeries. Treat dispensing toys like the Kong toys or Pet Safe toys, they're great because you can pop kibble in them and the dogs gnaw on those, and that helps prevent tartar. But we're still yet to find a solution that all vets can agree is absolutely safe. The problem is a dog can swallow a bone, they can swallow a toy, and they can swallow hide. And if they do that, any large piece can then obstruct the gastrointestinal tract and worse, perforate it. And so then you have a ruptured gut or a ruptured bowel. This is an emergency operation. It's life-threatening. I've done this procedure countless times. It's not fun. It is scary. And dogs die from this. So any vet will feel very nervous about recommending chews and bones because we see them when they go wrong. So you've just got to weigh up the pros and cons. You've got to see how your dog goes with it, and you have to supervise them. Clients sometimes ask me, because I say I don't recommend bones, then they'll try and trick me and say, well, do you feed your dogs bones? And that's a different question altogether, because it's one thing feeling like I can recommend something and sleep at night. There's another thing where I know where I'm doing it very occasionally, feeding bones that are only ever really large, that are raw, never cooked, that are meaty, and that I'm always only giving them to dogs when they're under close supervision. I also only give them bones after they've had a meal, so they're not scoffing it down, they're not hungry, and I make sure that the bone doesn't have a lot of fat on it and that they can't get into the marrow. And now I even had a comment in the group recently saying, oh, my dog loves the bones that can chew all the marrow out. And if that's not causing a problem, then great. But a lot of dogs get very upset tummy from a high fat content bone, and marrow is basically fat. So you can get upset tummies. You can get a condition called pancreatitis. So I keep the bones, raw and meaty, but also as lean as possible. I do it occasionally, and I know it comes with risks. So you've got to weigh up the pros and cons and make that decision for yourself. So to recap, guys, regular dental care at your local vet, daily brushing, which takes time and patience, but it definitely combats a lot of the plaque and a lot of the problems. High quality diets, whichever direction you choose to go, make sure it's premium range. Daily chewing. Now, however you feel that might be comfortable. It could be antlers. It could be rawhide. It could be, treat dispensing chews like Kongs. Or if you want to be very diligent and supervise your dog and make sure you're using large, raw, meaty bones, it can be bones. You've got to weigh up the risks and the pros and cons and go with something you're comfortable with. And I think to myself, when I'm feeding my dog bones, I think, well, there's risks in life, and my kids do risky things all the time that could end them up in hospital, but they're having so much fun that I just let them do it. And so it kind of is the same with dogs. If I know that there is risks feeding a dog a bone, but if I'm going to do it in the most safe way possible and I can supervise them and protect them to the best of my ability, then on the occasion I do it. So you've just got to figure out what's most reasonable and logical. then I think that's a good policy for parenting and being pet parents as well. Okay, I hope that is helpful. Lovely to jump on again. I'm sorry it's been a while. Have a lovely evening. Bye.